Welcome to Integrative Nurse Coaches in Action, the podcast where nurses, healthcare professionals, and consumers come to hear from inspirational nurse leaders in health and wellness coaching. We cover the latest innovations, ideas, and breakthroughs from nurses who are shifting the paradigm of disease care to health care through the art and science of nurse coaching. As nurses, we've experienced many conversations and situations that bring in assumptions and shame around body size, in our healthcare environments, and in our everyday culture. We're trying to practice from the lens of equality and judgment-free views, and yet we're faced with weight shame, diet culture, anti-fat bias, and prejudiced views around how we view body size, BMI, food choices, and more everywhere we turn. There are limited spaces for talking about body image, weight, food, and the choices within it, especially when someone's at a weight that's typically stigmatized. Tiffany North is doing incredible work as an integrative nurse coach and intuitive eating professional. She is focused on creating safe spaces for all body sizes to explore, unravel, and thrive in today's world, and shares thought-provoking and incredible information in today's podcast. Before we get to today's podcast, let's take 3 deep breaths in and out together. 1, 2, 3. Now, we're ready. As an RN, certified intuitive eating professional, and creator of the food attachment model, Tiffany North helps people with disordered eating finally find freedom, balance, and satisfaction. Tiffany's passion is challenging the harmful systems of oppression, especially weight stigma and anti-fat bias. Her coaching focuses on secure attachment, intuitive eating, body respect, and health at every size principles. She has worked with hundreds of clients and absolutely loves seeing their personal transformation. She's been sober since 1998 and feels that recovery has informed her work in all areas of her life. When she isn't working with clients, speaking, and writing, she enjoys seeking more fun, adventure, and play, especially traveling and time in nature. Welcome, everyone, to the Integrative Nurse Coaches in Action podcast. My name is Nicole Viano. I am your host, and I'm also a board-certified integrative nurse coach. And today we have the pleasure to interview another nurse coach from Portland, Oregon, which is exciting. On the West Coast represent. And we welcome Tiffany North, who's an integrative nurse coach, intuitive eating professional, and creator of the food attachment model. This is an exciting topic because we haven't had a lot of nurse coaches talking about food and eating and all of those important things that we all do every day. So I'm super excited to see where this conversation takes us, what pearls of wisdom Tiffany will share with us. And so we welcome Tiffany North.
Hi, thank you so much for having me on. Nurse coaching is such a passion of mine and has just been such a gift to me personally and professionally. So I'm really thrilled to be on sharing and, hopefully giving people ideas about what is possible for them in their career.
Awesome. This is exactly why we have the Integrative Nurse Coaches in Action podcast, to share our wisdom, to share our passions, to share our excitement for nurse coaching and how we're using it within the world. So, Tiffany, before we get into all those exciting details, we also love to learn a little bit about you and ask the question, how did you even discover nursing and what called you there?
It's funny because I kind of didn't intend to become a nurse, which I don't know very many nurses who accidentally became nurses. It's hard to do, right? And so I had a child at 18. I was going to college. I tried to go to massage therapy school. I tried to be a lab tech and nothing was really landing. And I just really wanted a career that felt, like something where I could really be helping people, but also where there was some like upward mobility or some opportunities to do different things, because I just didn't want to do one thing for the rest of my life. And that part of it has been so perfect for me because I've been able to do all kinds of things with it. And so, yeah, I went into the kind of counseling office in the college, and it was like, with the prerequisites that I've already done, what are some options? And they were like, oh, you can, you can do pre-nursing and try to go into nursing. And in Portland, it's really competitive to get into nursing school. Fortunately, they didn't tell me that. So I didn't know. I also had a partner at the time, and he was going to be a counselor or social worker, therapist. And, he and I were talking about nursing, and I was like, well, if you go nursing, then you can prescribe medicine if you become a psych nurse practitioner, and you can do therapy. And he encouraged me as well. So he said to me, and I still don't know how I feel about this exactly, but at the time it really struck me. He said, if you have the capacity or the capability to do something that not everyone does, then you have almost an obligation to do it. And at the time, it was like, okay, I can do hard things. It really motivated me. So, and then you got to get into like people pleasing and all of that if you really want to break it down. But at the time, it really opened my eyes to the idea that, I wanted to do something that maybe not everyone was able to do, and help people in a way that not everyone can. To use my unique gifts. And so it really motivated me to go ahead and do the hard thing and do all the prerequisites and get into nursing school. And he and I went at the same time, but ironically, we went to different schools. I ended up working at the hospital associated with his school, and he ended up working at the hospital associated with my school. So, but it was great to be able to like have a study partner and get through nursing school. So yeah, it was just sort of serendipitous.
That's a neat story, especially when you think, okay, well, when you're younger and you don't really know which direction you want to go in, and then what can you do? Well, massage therapy, lab tech, all of the things, right? And then, finding someone to help you focus in. And then sometimes, being shied away because you think something's too hard. And then the realization, like, I can do hard things. I want to use my unique gifts. I want to be able to show up in the world in the way that I want to. And so off to nursing school you went, graduated. And then what happened?
Gosh, I struggled to get a job. Actually, I ended up doing like overnights in these residential psych facilities for a while, which was, okay, but it was not really I was working through a temp agency. So like not really knowing the people there, and, it just didn't really feel like I was having much of an impact. And I thought I wanted to do like trauma ICU, really intensive nursing. Eventually I got an internship, but I wasn't quite ready. And that was really heartbreaking. They sort of like broke up with me. They were like, you're not quite ready for this level. And they brought me to this other floor, which was a head and neck neurosurgery neurology floor. And that floor was sort of a step down unit. And so it was better fit for where my skills were at. It was still higher level than, your traditional floor setting, but it wasn't the ICU, right? So I had trach patients. I had people who were, who had like brain tumors, glioblastomas, brain surgery. Sometimes it was just like back surgery people. We had a lot of like stroke patients. We had a lot of the head and neck surgeries. So people who've had total laryngectomies. And so it was a lot of variety. And that part was great. It was still staffed as a regular floor though. So it was like really intense. And eventually I hurt my back. So I had to, do all kinds of things on light duty. I did a lot of auditing. So I'd have to like go into the OR and make sure people washed their hands and did the like pause and made sure it was the right patient, all that kind of stuff. People did not love me being there, but got through that. And eventually I had a neurosurgeon just say, your back is not going to survive if you keep, you're going to have to, we got to try to make your back last at this point. And so I went into case management and did case management on the oncology floor. Then I went back to that neurosurgery neurology floor because even though it was the hardest case management job in the hospital, I knew the population really well and they really needed a good support person. I mentioned earlier people pleasing. So I was working, more than overtime. It was really I didn't get a lot of thanks for that job. And it was pretty grueling. Eventually I burnt out. And eventually, being burnt out, I was literally searching for another solution. And that's kind of what brought me to nurse coaching. And that was also really serendipitous. I started selling skincare, which is hilarious because I'm not good at sales and I don't even really care about skincare. Like, some people really do. Some people care about like aesthetics and all that. And I just really don't. And so I started doing these like little talks as like skincare as self-care because I heard so many people say, well, it's not so much the money, it's more that I just don't even like have the time to like wash my face at night. And I was like, how sad is it that we don't feel we can take 5 minutes at the end of the night to like wash away our day? And so I started doing all of this, speaking around self-care. And at the same time, I went to a barbecue of another nurse that I know, and she had a friend there who knew about nurse coaching. And she was like, that sounds more like nurse, like speaking about self-care sounds like a nurse coach thing. And I was like, nurse coaching, what is this? It just sounded so incredible and so much more holistic. And like, you can really help people in a way that, in the hospital, doing case management, I felt more like I was, just a cog in the wheel of like, this is what your insurance will offer. And we got to get you out of the hospital. And, just kind of like, I felt like I was helping people, but it was so limited. It was limited based on what their insurance offered and the hospital timeline. I didn't feel like I was really helping people at the level I wanted to. So that sort of pain for me of being, exhausted, physically and mentally burnt out, and looking for a way that I felt like I could be more effective or more supportive of people, meeting people really where they were at it was like the perfect moment for me to hear about nurse coaching.
I love this because there were certain things that happened in your life that led you in this direction, working in these high stress environments on that neuro floor, working with those high acuity patients and unfortunately hurting your back, but that caused you to move and shift in a different direction. And then that job caused you to shift and move in a different direction.
Mm-hmm.
And then started sadly moving through and facing burnout
Mm-hmm.
and all of the sadness and loss and grief that's associated with burnout. And then recognizing, oh boy, I need to find another job or something else because I'm burned out. I don't know. I just don't, not really sure where to turn at that point. And then being at a barbecue one day and then, hey, there's this nurse coaching thing. You might be interested in this, Tiffany. And then off you go in that direction. So tell us a little bit more about, okay, so yeah, you hear about nurse coaching and then what happens for you?
Yeah, I pretty immediately looked it up. I thought this other nurse might do it with me. She ended up not doing it at all, actually. So she was just my messenger, and I so value her for that. And when I learned about it, so funny because now I see it as so reasonably priced. But at the time it was like, it felt like such an investment, to do this. And my husband at the time, we had discussion around it and we had kids and, a mortgage and student loans and all the things. I just had this knowing. I just knew that this is what I needed to do for me, even if I didn't do anything with it, because that was part of the question. It's like, okay, you're going to take this training and then what? Then what? Like, I have no idea. Then what? Maybe I'll coach people around self-care or burnout or just health in general, or, who knows?
Right.
Well, then what? But I just knew that I needed to do this and that it was the right thing for me, even just for my own healing, to really find a more holistic way of relating to myself, relating to my patients or clients, relating to other people. It felt very different than my experience of nursing. Yeah. And when I went, my perception was like, not only was it different, it was like a whole different world, almost uncomfortably so. We would start at 9, first of all, which is like, in what nursing world do you start at 9? And then we would like, right? We would like get tea and greet each other, and they would give us a journaling prompt and we would journal, and then we would like share about, and I would be like, what? It's like almost 10 o'clock and we haven't done a single thing in my view, right? Like at the time I was like, when are we going to get to the content, or the like learn, the.
So let's pause here for a minute, Tiffany, because this is not the first time I've heard these stories. As fast-paced nurses coming into this world of nurse coaching, and where are we going to start learning?
Totally. That is the learning, right? That's a big part of it, is like learning to slow down. But yeah, it was really uncomfortable for me at the time. I had to, I also loved it, but it was just like, I had to really kind of check my internal pressure and pace and urgency. Yeah. So I took the training and I just loved it. I appreciated the mindfulness, a lot of the exercises that we did. I loved the connecting with other people, the sharing, all of that. I think because I'd already been doing some speaking around self-care and, talking to people about that and self-healing around burnout, the concept of coaching felt really natural to me. And just the learning, the personal growth and development aspect of it, that is also valuable learning. That part really lit me up. It took me a year to finish because my stepmom became ill and ultimately passed away like the weekend that I was supposed to finish, which was really hard, but it was good because I had, a lot of practice and a lot of time to get really comfortable with the nurse coaching skills and that role, and time to start really envisioning what I wanted to do with it, which again is when I was going into it, I had no idea what I was going to do. Yeah.
All these significant things happening in your life as reminders to slow down. Mm-hmm. Yeah. And so you completed the course, and you had some time in between to just kind of allow things to settle, allow the concepts to come into you a little bit clearer, and think about what you were wanting to do with this newfound training, newfound love. And at the time, the conversation with the significant other saying, well, what are you going to do with this when you're done? And, not knowing, just trusting that this was going to lead you in a new direction, in a direction that was calling to you, that you could use your unique skills to share with the world. So now, fast forward, because, so tell our listeners how long ago that was, so we have an understanding of how long you've been at this.
Yeah. And I can never quite remember the year or the cohort, but it was about 10 years ago. And yeah, it was really great for me. And I started sort of floundering around in the coaching world a little bit. Yeah, I didn't really know what I was doing, but I was like, all right, I'll get a business license and I'll do a, website, and I'll do the thing. I'll talk to people. I started going to a lot of networking events, which was really fun for me. I started taking a lot of trainings. There's so many free trainings in the entrepreneurial world, and did a lot of work around like my money story and, just things that like blocks there, people talk about like these blocks to having like a successful business. And so worked on all that stuff, but I was sort of coaching people in this general health and wellness using the coaching principles, but I wasn't focused enough, I think that. And so it felt a little haphazard because I didn't, it was like, I'll sort of coach you on whatever, and eventually my own health and wellness caught up with me. I was still doing the healing from burnout piece, and turns out that I had developed a couple of autoimmune conditions and started going down the very like naturopathic functional medicine route. Unfortunately for me, that route led to intensifying my disordered eating. I'd had disordered eating, since I was a girl. And at one point I think I developed a case of orthorexia and really struggled with food and my body image. So that again was, I feel like a lot of these shifts have come from moments of a lot of pain for me and searching for a way out and searching for something different. I was really fortunate to find someone who's trained in intuitive eating, which I'd never heard of before. I think I like went to the Brene Brown website and then like saw one of her, providers was in my area, like someone who was trained under her program, whatever that is, and learned about intuitive eating and did my own healing around food and my body. And then I started realizing that just about every woman in particular, but like most people I knew struggled with food in some way. And this was like a huge issue. And that as a nurse coach, I could easily get trained in intuitive eating and support them in a way that, again, one of those things like not everyone can, because I already had the nursing background. I already had the nurse coaching experience and background. And so I decided to focus entirely on food and body relationships. I got certified in intuitive eating. And it was just like, it felt like exactly what I was always meant to do.
That must feel just at ease to find a place where you just feel like this is what I'm supposed to be doing.
Mm, yeah. Yeah. And I'm so grateful for the nurse coaching piece, because had I not done that, I don't know. I don't know that I would have felt empowered to help people in this way. You can get professionals can get certified in intuitive eating. So even just being an RN, I could have gotten certified. There's also like a layperson version where you don't have as much freedom to do what you want with it. But yeah, I could have gotten certified in intuitive eating, but I already really saw myself as a coach. I really saw myself as someone who wanted to help people in a very holistic way. And I already had some of the coaching skills. So like, I remember in the intuitive eating certification program, people who were, who had various professional degrees, but who weren't coaches, some of the questions that they would ask, I'm like, oh, they're asking a coaching question, not an intuitive eating question right now, right? Like they're asking, like, how do you talk to people would literally say, like, how do you talk to people about their relationship with food? And it's like, oh, well, I know how to talk to people about things that about their health and things that they're struggling with. And it just felt really easeful for me because I'd already been doing it.
So good. So good. Okay. So we have to back up a little bit, because I would love, and I know our listeners would love, to learn a little bit more about your understanding and how you define intuitive eating, so that we could follow along with you a little clearer and learn for ourselves too.
Yeah, great. So intuitive eating was created by a couple of dietitians back in the 90s. So there's a book and there's principles and, similar to like nurse coaching, there's like in order to call yourself, a certified intuitive eating professional, you have to go through a certain process, right? So just that's out there. Because there's all sorts of people who will say like, oh yeah, intuitive, there's even like intuitive fasting, which is a diet. But anyway, it's very like, people will use the language however they want. So it's similar in nurse coaching that there's a process for becoming certified in that. And so intuitive eating is really about letting go of shoulds around food, letting go of this food is good, this food is bad, and instead looking at food from a body attunement lens. So how does this food feel for me in my body? How does eating in this way feel for me in my body? What are the underlying needs associated with various like body signals, right? So we use body attunement a lot, but the scientific word is interoception. So that's like being able to feel like your heart rate, being able to feel what's happening viscerally for you. And so that's a skill that we can develop. It's not always taught in our culture. So often we're actually taught the opposite. We're taught, clean your plate. We're taught your hunger is dangerous or bad or scary. You should ignore it because you don't want to eat, quote, too much. It's often very focused on like body size. Like if you're at a certain weight, then your hunger is not valid or is risky or dangerous. We're also taught to do that with our emotions. Don't cry, suck it up, move, just like push past, move through kind of a thing. And so I feel like intuitive eating is actually very aligned with nurse coaching concepts and principles, because it's very much based on body wisdom and building body trust and really listening to your body and honoring your body's signals.
Thank you. Now we feel like we're okay. We understand a little bit more about this, because, you do hear, like how you just mentioned, you hear a lot of different things. People who maybe aren't certified, but they may have read an article on it, all of a sudden appear to sound so professional about it, and may not even be defining it as appropriately as what a trained professional with a certification would express themselves as. Okay. So you found this intuitive eating, you educated yourself, you achieved the certifications, and now you're using this and your coaching skills. So what I love about nurse coaching is, first of all, nursing. We got our education in nursing. We may have specialized in certain areas within the nursing field, within a certain specialty of Mind's intensive care. Yours is neuro and case management. I mean, all of the things, we're always exposing ourselves to something different. And then you found nurse coaching. So you layered on more education to your nursing education. So you're layering on new tools, new theories, new experiences onto your life experiences and everything else too. And then you practice nurse coaching for a while, just in kind of a general concept. And then you just kept getting called in the direction towards intuitive eating, then gaining more experience in there and new understandings, new interactions, new experiences to layer on top of all of your other layers. And I just think that is the beauty of one, nursing, because we have so many opportunities, and also integrative nurse coaching because it has offered us new ways to show up as nurses. And then we take that skill and then we're looking for our real true passions to combine it with that. Mm-hmm. And then showing up in the world as authentic as possible. If only we're all so easy.
I mean, there's a lot that goes into it for sure. Right? But I feel like nurses are not the kind of people who really shy away from like rolling up their sleeves and doing the hard work and putting in energy and even having patience, because I didn't know, about nurse coaching. I didn't know about how to care for myself through, burnout, all of that stuff. I didn't know about intuitive eating. So, it was sort of like, okay, these things are coming. And yeah, each stage kind of prepared me for the next one in a way that I so value now. And like you're saying, it's also sort of like collecting these tools as you go. And there's definitely tools that I use from, my nurse coach program. Even now I do a landing with my clients that I just like made up, it's not, but it's based on like a lot of the grounding techniques and then mindfulness techniques. And, we got like an entire little booklet of all these different like mindfulness techniques. And at first I felt like I needed to like read from the script. And then I would be like, oh, I don't really like this line. I'm going to shift that a little bit, or I want to add this little piece, or, whatever it was. And now I'm like, I could just make up a landing on the fly and it's completely valid. If it works for my clients, that's what's most important. Right. So yeah, I feel like I'm constantly pulling in from my personal experiences, from my professional experiences, from trainings and books and podcasts and learning. And I get to use all of that in nurse coaching in a way that's the integrative piece, right? And in a way that I feel like I wouldn't have known how to use a lot of these skills or apply them. It's like I heard this podcast in my kind of regular nursing job. I didn't really feel like I could be like, oh, I can help you with this podcast that I learned, and now I feel like I can use every tool available to me. And it's not like you can't do it at the bedside or, that sort of thing. It just really prepared me to be able to pull from different areas and flex them to meet the person that's in front of me with them.
Yes. Such a great explanation of our abilities to flex, right? Mm-hmm. To whomever is in front of us and our allowance of that. Letting that happen versus feeling a little more constrained sometimes when we're working in a healthcare system.
Mm-hmm. Yeah. And I think even for nurses who become coaches in the healthcare system, while still in the healthcare system, it's sort of this permission of like, okay, I can justify, if anybody ever calls me before the board, I can be like, I have this training that's taught me, how to do this safely and appropriately. And so it is nice that empowerment piece to bring in the holistic support for people. Yeah, it's so beautiful to me. I love it.
Mm. Well, you make a really good point. We aren't doing this willy-nilly. There are theories and backup to what we're doing. This isn't just flying off the seat of our pants or by the seat of our pants to make things happen. And there is creativity within what we do as well. Yeah, it is based on theories and it's based on protocol and it's based on different experiences as well. So thanks for bringing that up too, because yeah, this is because we have done the hard things, right? We showed up.
Totally.
Yes, we've done the hard things and we're showing up. and we're learning and experiencing as we go. So I would love to know a little bit about, what happens in a session when you're working with someone with this intuitive eating style. Like, tell us a little bit more about this,
Yeah,
please.
thank you. Yeah. So one of the things I didn't mention is so I did say, it's not based on shoulds, but it is an anti-diet approach. So we're not like, this is a good diet or this is a bad diet or this is the diet you should use. With that comes a lot of undoing of the systems of oppression that contribute to things like weight stigma, diet culture, anti-fat bias.
And now, a word from our sponsor. The Integrative Nurse Coach Academy offers nurses innovative approaches to re-energize and expand your nursing practice with new skills and tools that focus on lifestyle health and well-being. As an integrative nurse coach, you will confidently promote wellness and resiliency by guiding your clients, patients, and communities to deepen their connections to inner healing resources and expand their capacities to make meaningful choices for healthy lifestyle change. Plus, you'll learn critical self-care tools to actively take care of your own health and well-being on the journey. Join the global Integrative Nurse Coach Academy community and rediscover your passion for nursing in the online Integrative Nurse Coach Certificate Program. Learn more about our programs at inursecoach.com. And when you register for the Integrative Nurse Coach Certificate Program, be sure to use the code ACTION to get $100 off the Part 1 and 2 bundle. Now, back to the podcast.
With that comes a lot of undoing of the systems of oppression that contribute to things like weight stigma, diet culture, anti-fat bias. So a lot of the time that I'm working with people, it's looking at what messages have I internalized that are not helping me in my relationship with food or my relationship with my body. What are the messages that taught me that my body isn't to be trusted, or that there's something wrong with me if I eat, a bag of potato chips or whatever it is, right? So we focus on building body trust. We focus on undoing messages of shame, self-hatred, messages, negative self-talk toward your body. We focus on, if I'm not going to try to eat based on shoulds and shouldn'ts, then what do I do instead? Which is, I think, what most people are really curious about.
Yeah.
So I'll talk a little bit about that. And we also focus on, I end up doing a lot of work around trauma with people, because when you've internalized the message that your body isn't good enough as it is, which we're all sort of marinating in that message, then it creates and this is part of my model, what I am looking at as an attachment wound. It creates this wound with yourself that, I'm not good enough as I am. And so I need to do something, I need to change my body for it to be good enough. And so that, to me, is an attachment rupture with yourself. It also can create attachment wounds and ruptures with your caregivers, because, if your caregiver, a client of mine, mother put her on a diet when she was 4 years old. If your caregiver puts you on a diet when you're 4 years old, that creates, attachment wounds. And to me, trauma is any unhealed wound. And I don't think we can really do work around, why do you feel like you're a bad person if you eat 2 cookies, without looking at the underlying trauma, some of the stored and stuck trauma in the body, and then some of the, like I said, some of those internalized messages, that shame and self-hatred that comes along with it. So we look at, how do we undo automatic negative thoughts? How do we counteract those messages of should, and build that secure attachment with yourself, that inner wisdom and that trust with yourself. So that said, that's all the theory behind it. Not all, but that's some of the theory behind it. So what a session looks like is, well, first of all, I decided a long time ago that I didn't want to have like a per session, you show up as many sessions as you want. I wanted to have a really solid container. So this is another piece that's cool about being a nurse coach, is that I can choose what container I set with people. So people, when they come to work with me, we have a free session and decide if it's a good fit or not, and then a free consultation. And then we work together for 6 months minimum. So that's, we have a contract for that. And that's because it took decades, for them to get to this point with their relationship with food and body. And it's going to take at least a couple months, right, to work through some of that. If somebody didn't need 6 months with me, of course I would be flexible, but most people need much more than that. So we have this container of a lot of trust with each other. We know we're going to be spending a lot of time together, and it creates a ton of spaciousness. And within that 6 months, I offer unlimited coaching. So typically I see people for an hour a week, but some people need to be seen twice a week. Some people need every other week because of different learning styles, different pace, different, preferences around support. So typically a person would come to me, saying I'm struggling with body image. I feel bad about my weight. I feel, I'm struggling with like binge eating, or I'm struggling with restrictive eating, or I just really don't know, what to eat. I sort of eat whatever, and they're really wanting to change the way that they eat, and often still try to want to change their body. And so we look at, why is that? What is it about your body that's concerning? What is it about your relationship with food that's concerning? And then we start to try to tease out the underlying issues and the underlying needs there. So I still haven't answered what is a session like.
Well, this is good, because now we're starting to really understand some of the background that goes with this. So yeah, keep on going, Tiffany. This is great.
Yeah, thank you. Yeah, it's very complex. Our relationships with food and body are extremely complex. We have the caregiver piece, we have the, cultural piece, we have the community piece, and then we have like our own personal preferences, sensory issues, all of that, right? So there's a lot of layers. So a session with me, somebody comes, at their scheduled time, and we would do a landing. So it's like getting comfortable, taking some deep exhales. I guide them through connecting with the outside of their body. How does it feel against the support under them, gravity, that sort of thing. And then we start looking at, what's the inner landscape like today? We would sit with a sensation that's present, allow it to grow, really sit with it and be present with it. Then we might connect with our inner wisdom, see if we can offer some nurturance or support or curiosity or compassion to that piece. And then we're going to zoom out and, look again at, are there any needs being signaled, giving some acknowledgement for our body. So this is a process that I call the 5 A's. So it's awareness. Awareness is huge and key. And this definitely goes back to my nurse coach roots, like so much. Acceptance, allowing. So accepting that everything that's present is valid and there's room for it here. And then allowing, just really sitting with it, because that's part of like metabolizing through whatever you're feeling in your body. And then acknowledgement. So that's kind of naming what's going on and also offering some gratitude for your body. And then the 5th A is action, ? Or honoring. And the reason there's a question mark is that sometimes just having awareness, allowing that, whatever's happening in your body to happen, really feeling your feelings rather than thinking about them, sitting with what's present in your body. Sometimes that's all that's needed. That's the most critical part. Sometimes it's like, oh, I eat emotionally every time my mom calls me and we get in a fight. Right? Like maybe I need to set a boundary with my mom, or, I'm, super burnt out at my job. Okay, well, maybe there's an action that needs to be taken there. But also maybe you need your income and maybe you're not really ready to do the next thing, right? So there's a question mark there. And maybe there isn't anything that needs to happen right now other than naming, hey, this isn't working for me, and I want to move toward doing things in a different way that's more supportive for me. So I created that just based on, like, again, the tools that I'm pulling from all kinds of different places as sort of a process of connecting in with our body and then honoring it. So in that process, not only are we practicing body attunement, I'm allowing them to sort of borrow my nervous system and really settle into it. I'm sort of helping them through that process, but we're also practicing how to build that trust with ourselves, right? And so we do that right at the beginning of the session, and then we start talking about what's happening with the person, around food or their body, what's coming up for them. And sometimes maybe they went to a barbecue and somebody made a comment about their body, or they have to cook dinner for their family, and their family's like, everybody complains about the food, or, whatever, right? So they might just have some everyday life thing happening that we want to examine. And the principle here is that when we can retroactively look at situations that made us uncomfortable or hurt us or were challenging, and learn a lot about what's going on with their nervous system, learn a lot about what's going on, what are your preferences around food? What are your needs right now? And sort of break that down and look at the patterns, because the patterns tend to be the things that keep us stuck, right? We tend to kind of act out these patterns over and over and over. And so by going through things in session that they're struggling with or that are coming up for them, I can help them see the patterns and really come to clarity for themselves around what are the challenges here? What do I want to do differently? What's working, what's not working? And we can begin to shift and have more sustainable change closer to the relationship with food and their body that they want, that's based on their own inner compass, not somebody else's list of shoulds and shouldn'ts around food and body.
Yeah, because we've all been exposed to all of those other people's lists.
Yeah.
And food in general, I think is a very powerful thing.
Mm-hmm.
We need to do it multiple times in a day. And everyone has their own thoughts and opinions on food and how that is,
Mm-hmm.
and experiences and such as well. So you're helping people unravel that. So these thoughts and feelings and things that they want to address, it becomes their story instead of someone else's story.
Exactly. Yeah. Yeah. And it can be really powerful when we ask our bodies how we feel about it, rather than, and this all may sound sort of nebulous, but when talking with someone about what's going on, I'll always have them pause. What's happening in your body right now? So if you're talking about the situation, maybe you're talking about like the holidays are coming up and you feel like it's frantic and you have to do all of these things. It's like, let's pause. What sensations are happening? Oh, my shoulders are up to my ears and there's tightness in my chest and a lump in my throat. And like, wow, okay, your body really has some things it wants to say about this. And when we can listen to that, and then again, bring in that curiosity and the nurturance and the compassion, if you're looking at someone who has a lump in their throat and tightness in their chest, what would you offer them? So building that for ourselves, there's a lot of wisdom there. So this kind of goes back to that nurse coach principle of honoring, the client's wisdom rather than our own beliefs about something, right? Their own knowing, and helping them get close and connected with that. And sometimes it's like, oh, I don't want to do any of the holiday stuff. Or sometimes it's like, oh, I want to do all of the holiday stuff, but what's really important to me is this. Or I just need more self-care around it. Or I just really need to set a boundary with my family that like nobody comments on my body, or nobody like comments on the food that's on my plate, something like that. And I can't know that for them. I can't know what is it about the situation that's causing you so much stress or pain or sadness or grief. What is it that really hurts about it? And then knowing that when we go to the body, we can get that information pretty readily. What is the thing that's going to feel supportive of this part of you that's really scared or sad or hurt? Or what is it that's going to make this situation more easily navigable for you?
And you're creating this safe space for people to explore this. Many have never explored, that has not been safe, has not been a safe space.
Yeah. And a lot of that is because of all of the shoulds and the shame around, there's a lot of assumptions around body size. So, in nursing, we're exposed to it as well, right? We're exposed to a lot of stigma and anti-fat bias, and the way that people are spoken about that are in a higher BMI. Even the BMI itself is problematic because it's based on, it was never designed to be a good measure of an individual's health. And there's actually a lot of racism built into the BMI system and the healthcare system around body size as well. And so when someone's at a weight that typically would be stigmatized, there's a lot of self-blame that happens. And so there legitimately hasn't been safe, right? And they haven't had an opportunity to base their choices on, how they truly feel, their own inner wisdom. Instead, it's been trying to comply with the system that they've been presented to. Yeah.
Right. Just trying to fit into the mold that someone else created. Mm-hmm. Mm-hmm. So as I'm listening to you, I feel your energy. It is, you're, passionate about this, and you are, truly passionate about what you're sharing and the work that you're doing. And so I'm curious to know some of the successes that you've experienced within yourself, maybe not with the clients. The clients, I'm sure they have plenty of successes, but I'm just curious about yourself and how you feel with doing this work.
Yeah. So for me personally, it's interesting. There's so many ways that I don't fit our typical culture. And one of the ways is neurodivergence. And so by doing this work and really coming to a place, so the kind of foundation of all of this work is that each person is valuable and worthy of love and respect as they are inherently. We all have inherent value, and our value shouldn't be based on, being thin or looking a certain way or even eating a certain way or any of that. But also like your brain working a certain way or having a certain level of achievement or any of that. That was a big part of my healing from burnout, was really recognizing that my value is inherent, whether I got the things done on my to-do list today or not, whether I work for the hospital or I don't, whether I work, 40 hours or 10 hours in a week, that none of that shifts my value as a person. And so I feel like my own personal path has helped me come to that place of healing, which now I see as having secure attachment with myself. We haven't really talked about the attachment piece of things exactly, but yeah, coming to a place of secure attachment with myself. And because of that, I've sort of embraced my neurodivergence. It's like, the way that even my workflow, like I've been writing a book, the draft is complete, and it has taken me a couple of years, and it's been really challenging because I'm not a writer. I just have a message. And I'm dyslexic and, all kinds of things, right? So it's been really challenging, but I've ultimately come to a place of really valuing my neurodivergence because of the way that my brain works. And even this podcast might be difficult for some people because it's very like, conceptual and right. It's kind of all over the place. That's the way my brain works. And because of that, I'm able to see patterns where other people don't. And that helps me in not only creating this model, but in my individual coaching sessions. And it's fun for me to have my brain be this way, right? I love listening to a podcast and then like, oh, that applies to this thing over here. And oh, so and so might be interested in that. And it, all of these sort of network connections light up in my brain. And so, yeah, it's been that I think has been my greatest accomplishment. And I feel like now I show up as the person I am everywhere I go. So I tend to not go into spaces where I have to pretend to be something else. And I'm just like, this is who I am. I'm transparent. I'll answer questions honestly, you know, even if I think the person might judge me or, they might not agree with my lifestyle or something like that. And because of that, I just have a lot more ease and peace and joy in my life.
And that's all we really want, is for everyone to just show up like they are. Be who you are. Your things are, unique to you, and, acceptance and ease and all of that. Yes, please. More of that. More of that.
Totally.
Yes. So we have a few moments left, and we'd love to know a little bit more about the food attachment model. And can you sum it up pretty quick?
Yeah, I think I can. Yeah.
Yeah. Okay,
So,
good.
yeah, so the food attachment model was born. I was doing a little bit of research personally about attachment theory. And I realized that I'd already healed my relationship with food in my body through this work. And so I realized that I was doing attachment work with clients and it made a lot of sense to me. So the idea is that there are folks who are more preoccupied and anxious around food. This is people who are always going on a diet on Monday. They're always meal planning. They're super focused on it, right? And then there's people who are more avoidant attachment. And those people are people who are like, I don't really pay attention. Maybe I don't eat all day and they just have like a box of cereal for dinner or whatever, right? And then there's people who are anxious avoidant. And these are folks who are typically who have like a severe eating disorder, who are they're kind of very avoidant of their body. They really don't want to eat food or try to avoid it as much as possible, very, very anxious. And then there's the people who are just securely attached with food, who just like it, they enjoy it. It's not a big thing in their life, right? And so if we can look at it from that framework, we can take, okay, this is where you're at right now, and we can work toward moving towards that secure attachment with self, which again has to do with like healing attachment wounds, letting go of shoulds, building that body attunement, because that body, the disconnection from body is so prevalent in our culture. And when we can come to that place of secure attachment, we don't have to have shame about it anymore. And instead, we can be flexible and meet ourselves where we're at in that moment. Whether you're pregnant, whether you're sick, whether you're going through menopause, it changes over your lifetime. But if you have that connection and trust with your body, you can show up in that way rather than an anxious or an avoidance pattern.
Thank you. That makes complete sense.
Yeah.
And I really appreciate how you decide I'm going to make a model of my own based on my experiences and based on my learnings and using attachment model. And it just makes sense, right?
Yeah, thank you. Yeah, I actually had somebody suggest that I should create a model. This woman who used to be my virtual assistant, who was she was a teacher, and I was like, I don't even know what it would be. And when this hit me, I was like, this is my model. But again, if I hadn't been a nurse, I don't know if I would have felt like empowered. I'm like, nurses make models. I can make a model.
Yeah. Heck
So
yeah, we can all
I've
make
just
a
done it.
model.
Yeah. So again, I'm so grateful for this path and for nurse coaching. It's just really led me to a place I couldn't have ever imagined, and that is deeply fulfilling.
Yes, I'm thankful and happy for you. Yes, 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 yes. Okay, so we have just a couple minutes left. So I love to ask a certain question.
Okay.
And sometimes you have to think about it, and that's okay. Please tell us what is on your heart that you would like to share with us today.
Mm. I think that piece about, the honoring part of the 5 A's that I use, it can be so hard because just as we have shoulds with food and body and, all of that, there's shoulds around showing up in a certain way, taking care of other people, earning a certain amount, like all of that stuff. And it can be really scary to diverge from the expectations and the cultural norms. But, if you're listening to this podcast, that tells me that you're somebody who's seeking. And so I would just say, learning to honor that whisper, from your body of follow the go down the little alleyway or the path or whatever it is that's calling to you. Honor that, yes, because there's the cliche of like life is short, and it's really like you're the person who's going to be. You're the only person who's truly in charge of your, what your own satisfaction and your own really caring for yourself, right? And so if we're able to honor what's important to us or the things that we're feeling called to do, it can really lead to so much more satisfaction. It can lead to so much more joy. It can just open up things that you would never expect.
Thank you. Thank you for sharing what's on your heart.
Thank you so much for having me. This is really fun.
Yeah. So, Tiffany, how can we find you?
So my website is CoachTiffanyRN.com. I'm also Coach Tiffany RN on Facebook and Instagram and TikTok and all the places. I do have a quiz if you're curious about your food attachment style. And so that's on my website. I think it's like CoachTiffanyRN.com/quiz, or you can go to the little drop down. That can be a fun way to learn more about your own food relationship. And you can also get on my email list through taking the quiz or going on my website.
Awesome. Okay. Well, thank you for sharing all those details. We'll for sure drop the links into our show notes and on our webpage. Yeah, this has been just fabulous just to soak up all your wisdom, and gives us things to think about, right? And to consider. And, hopefully if our listeners are needing some support in this area, to please reach out to Tiffany so that she can support you in this very important work that we're all doing, related to eating or related to any other probably issues, right? Yeah, because it's all work that we all are doing to support ourselves so that we can support our communities as well. So, Tiffany, we also like to do a little fun questions. Okay. So don't think too hard. They're just going to come off the top of my head. So tell us your favorite food, since this has been about food.
My favorite food, I love all food. I'd say my favorite food group is like Asian food in general. And my most recent favorite food experience was being in Costa Rica, and they had like deep fry like an entire snapper for you. And
Woo!
oh my gosh, it was the tastiest meal I've had in ages. So yeah.
That sounds, that sounds so good. Yeah.
I
Yeah.
also love cake,
Amazing.
and it's about to
And
be my
cake.
birthday. So I'm going to be eating a lot of cake.
I love it. Well, thanks so much for being with us. We really appreciate your time and your passion, and just want to send so much love to you.
Thank you very much.